Hello, this is Dr. Stanley Lang. Welcome to the video on restless leg relief for restless leg syndrome. And so the reason I'm sharing this video today is because of a patient that I saw today had a particularly difficult case of this problem. And so I just wanted to share some comments on it, on the subject for people that are suffering with restless leg syndrome. And you might have very mild cases where occasionally your legs feel twitchy at night, or you might have severe restless leg syndrome where you have lots of interrupted sleep because of the symptoms, or it might be something that sort of comes and goes. And one of the things that's interesting about this condition is that it really wasn't much of a condition until there were some drugs to treat it. Prior to the onset of some drugs that were brought to the fore to be used for restless leg syndrome, it really wasn't that much of a condition that was being treated. And in fact, I always saw it as what it is, which is primarily a muscle inflexibility program. Now, there's a small percentage of people under this umbrella of restless leg syndrome who have truly a neurological condition that needs a different approach than what I'll be talking about here today. But for the majority of people, the issue is that they have a muscle inflexibility issue that is causing their muscles to feel funny. It feels twitchy or feels just uncomfortable. And so they have to move their legs to get comfortable. And that little bit of movement gets them a few moments of comfort, and then they start to feel uncomfortable again. So for the vast majority of these people, flexibility is the cure. Inflexibility is the problem. So what I've developed over the years is a program that is basically a flexibility program, and that works for almost all of my patients with restless leg syndrome. Over the years, I've also added into that several other things that help the muscles to relax, because for a small percentage of people, these other things make a big difference as far as the effectiveness of the stretching program that I've developed over the years. And so this stretching program, I think, is really critical because most people do stretches completely wrong. And that's because they were taught to do it completely wrong. And one of the reasons for that is because the ideas of what is safe and effective stretching has never really been studied in a scientific manner, in the sense of controlled studies comparing different ways of stretching. We have a lot of opinions out there, by strongly felt opinions. And so what I see is that a lot of people do stretching in a way that actually aggravates their muscles. If you go on the internet and look up restless leg syndrome, some of the video instruction is exactly opposite to the best solution to getting the muscles to relax. And so my encouragement is that if you're not sure about how to do good flexibility and you have restless leg syndrome or something that you think is restless leg syndrome, that you take advantage of the program that we've developed and has helped many, many people over the years. For less than a cup of coffee a day for a month, you could have access to the whole program. And so if you've got restless leg syndrome, click on the link below to take a peek at the program. And I wish you well either way. If you don't want to get the program, I do want to just tell you that for most people, if they get into the right flexibility program, they will achieve relief of most of their symptoms. And in my experience, more than 90% of people have complete relief of their symptoms without taking any medication. So if you want to learn how to do that, click on the link below this video or on the video. I wish you well. God bless and have a great day.